Good day, colleagues. I'm not sure if ever you can hear me. My name is Bonkosi Ndlagamandla. I'm the National Coordinator for MenEngage Eswatini. I'm very happy to welcome everyone to this session, which is our roundtable skills building session on addressing intimate partner violence. I'm the National Coordinator for MenEngage Eswatini, whereby we are engaging men and boys for gender equality. So I'd love to welcome everyone, and also I'd love to take this opportunity to request my fellow panelists to introduce themselves. I will start with Elise. Can you introduce yourself?
Good morning, colleagues. My name is Elise Prince. I am the country coordinator for MenEngage Namibia, but I am also the gender program manager at Lifeline Childline in Namibia. And I'm really excited to join the discussion today and looking forward to learn from you.
Thank you, Elise. Can I request Clive to introduce himself?
Good morning, everybody. My apologies for taking long there. My name is Clive. I hope you can all hear me. Clive Asij Mwandingi. I am the MenEngage Namibia chairperson for the steering committee. I'm also the MenEngage Namibia advocacy representative on the regional level. Thank you very much.
Thank you, Clive. Can you, Andrew Moyo, as well, introduce yourself?
Good morning, colleagues, and good morning, everybody, all the panelists. My name is Andrew Moyo. Bongosi, can you mute yourself? I'm hearing a lot of feedback. Thank you. Sorry, colleagues, for that hiccup. My name is Andrew Moyo. I am the founding director of Msimisi Community Project and also the MenEngage chairperson. I'm so excited to be part of the panelists here. I'm so excited to be part of this initiative, and I'm looking forward to hearing more from from the colleagues and on what is happening in the region and around the globe. Thank you so much.
Thanks, colleagues, and thanks, my fellow panelists. And I'm very much excited to be part of this session. Indeed, colleagues, I believe this will be a very interesting session whereby we learn from each other, because we are talking about something that is troubling each and every one of us. To start with, it will be very much important to note or to even share why, as the MenEngage, we are concerned about intimate partner violence, which is not only a concern for the MenEngage network, but it is a concern for everyone who's working around, working on issues of social justice. So there are few things that I want to touch on around why exactly is intimate partner violence a concern. In the context of Eswatini, intimate partner violence is one of the major contributors of HIV transmission, and also intimate partner violence affects 1 in 3 women around the world. And also in the context of Africa, intimate partner violence is the 10th leading cause of death of women aged between 15 and 29. And also, intimate partner violence contributes to more than a third of female homicides are committed by intimate partners. And also, there is a significant positive relationship between financial insecurity and intimate partner violence. And also, 26% of sexual violence cases against girls are perpetrated by their boyfriends or partners. And also, there is an issue that out of 29%, 21% on one study that was conducted, 21% of women surveyed reported physical violence from their partners. And there are quite a number of issues and other factors that also affect the society that we're in around issues of intimate partner violence. That comes as a cause of intimate partner violence. And then this raises a concern that says, what then do we do to end intimate partner violence? But before we even reach to say, what do we do? We first need to understand what is it that drives intimate partner violence? Because in order for us to be able to address issues of intimate partner violence, we need to understand the root cause of intimate partner violence. As MenEngage Eswatini, we are working on issues of intimate partner violence, whereby we've even conducted the study on the drivers of intimate partner violence, and whereby we found out a number of issues from the study, and also we are currently working around implementing those recommendations and addressing those drivers. But before I get into what exactly are on the session, but then I'd love to first share briefly the guide for our conversation, because our conversation is structured in as much as it's structured around issues of intimate partner violence, but we've got 4 parts that we will be mainly discussing on, because whenever we were to talk about intimate partner violence, we could take the whole day, but we only have 2 hours, colleagues. So with those 2 hours, we try to cover up around issues around 4 sectors, whereby the first one will be on issues of what are the drivers of intimate partner violence, and also we would love to touch on the loopholes on the systems on addressing intimate partner violence. We also want to touch on what are the gaps in addressing key stakeholders, because we've understood that there are gaps that are existing when we engage stakeholders. Then we want to touch on those gaps, and also we want to touch on briefly on the successes or what worked in the context of Namibia and Eswatini in addressing intimate partner violence. And also we will get to the point whereby our fellow participants can ask questions or can also share their views on the topic that we are discussing on, colleagues. And we are hoping as well to learn from each other, because we are not coming here as experts or as individuals who knows everything around issues of intimate partner violence. There are other success stories or key information that will come from other colleagues from different parts of the world. So we'd love to know how we can work around addressing, because this is a serious concern for our communities. Right now, I'd love to get on to the drivers of intimate partner violence. In our study, we found out that there are 3 main drivers of intimate partner violence, which then influences the individual behavior. The first driver that we found out is socialization, whereby under socialization, there is an issue of patriarchy, which is the main dominance that says a man is superior than women. So that on our study, that's presented to be a problem amongst the drivers, because violence is used in relationship is used to control or to push one to maintain her position, because in most cases, intimate partner violence cases, even our study, we found that women and girls are the most victims of intimate partner violence. So violence within the patriarchal settings, violence is used as a tool to keep women in their box. And also there's this issue of gender roles, that within the relationship, certain roles are prescribed to be a responsibility for an individual, and then which in turn that causes the issue of the sense of entitlement or authority, and also it then pushes on issues of minority status of women and the societal acceptance of violence, because even in communities, even at family level, whenever there's an issue of violence, the discussion, the spirit of the discussion, the spirit of the conversation is towards blaming the survivor and also protecting the perpetrator. And also there's an issue of that there's, because in our study we interacted with both the perpetrators and the victims. Whilst engaging, we found out that some of the perpetrators or some of the survivors, they were not taking necessary actions against those issues, the issues of violence, because they once experienced it on childhood, and also from their developmental, they accepted violence to be as part of as part of life, as a way of life. And also there's the issue of angry individuals. Due to experiences from the past, they are also angry. And also there's this issue of governing entities or institutions. Amongst other issues, we found out that the way service providers, whereby those institutions that are entrusted with helping survivors of gender-based violence or dealing with issues of intimate partner violence, the way they provide their services, it also drive intimate partner violence. Among the things that came up there is that the way we deal with these issues, it shows traits of condoning the violence, and also there's an issue of negative attitude towards survivors. There is issue of weak governing structures and institutions. You find that the way we deal or we attend to cases of intimate partner violence, we have very limited response, or we have very limited structures. You find that in the case of intimate partner violence will take so many years before it's being concluded. And then in that particular time, the perpetrator will be continuing abusing the very same survivor. And you find that our countries do not have systems in place to ensure that whenever there is an abuse that has taken place, you will bring those people, let's say, for instance, the police station, they will go to the police station, and then I'm reporting my partner. After the discussion, I'll have to go back home and return to be at the same vicinity with the perpetrator of abuse, which in turn then pushes to a point whereby there are high chances of victimization. So, those are some of the challenges that we highlighted under the driver of governing entities or institutions, because they also touched on the issue of rewarding of perpetrators, whereby you find that on the rewarding of perpetrators, they highlighted the issue of the consequence of abusing someone is for you to be reprimanded for that. But you find that in most cases, perpetrators of intimate partner violence, they are not reprimanded, of which that is viewed as a reward for them from perpetrating the other person. And also in some instances, in the context of Eswatini, we've seen cases whereby you find that as an influential individual that has been reported to be abusing his partner, 3 weeks down the line will be promoted to a higher position, of which that in turn makes people not to believe in the judiciary system, and also to say if ever you are arrested in connection of intimate partner violence, it is not based on the fact that you violated someone. It is based on the fact that you are a nobody. So they feel like they can just arrest you. It's not based on the severity of what you've done. It is based on your influence. So that's amongst other issues that comes in with under the governing entities. And the other one that came up during our study is that there is an issue of globalization, whereby they say within a relationship, you find that one will be open to new trends of lifestyle, whereas the other one is remaining behind, whereby you find that even in terms of new laws that are being put in place to protect their citizens, you find that the way the couple accept those laws, it will be different. And also the way that it normally happens in the context of Eswatini, you find that they will go to the UN meetings, and then there will be new resolutions that have been approved, and then they will come back. And then when the deadline is approaching for countries to adopt those resolutions, they will then now rush into adopting those resolutions so that they will be in compliance of the resolution, without engaging the citizens, without engaging, doing consultations with the various, with the public. And you find that those resolutions are put in place, and then they are now conflicting. There are those who are for those resolutions, and there are those who are still not understanding, and they are still not accepting those resolutions. And that tends to then cause a drive, the quarrel within the family. And also, there is an issue of adoption of new lifestyle, whereby you find that the new lifestyle, maybe one partner within the relationship is now adopting a new lifestyle, which is at times you find that it's more expensive than what the family can afford. And then at the end of the day, then that causes the quarreling and the abuse to take place between those two, between the couple. And also, what was highlighted that what we've noted is that there is an inadequate life skills, whereby there is an issue of the couples now, they lack anger management skills. They don't know how to communicate with each other. There's lack of communication within the family. And also the issue of anger management. There are high levels, because from the respondents of our study, we found out that a lot of people, they've got this embedded anger within them, which they have never even communicated with their partners. You find that most of this anger emanates from their childhood, but they do not know how to communicate with their partners. And also the issue of disrespect.
Yeah, colleagues, it seems as if we have lost Bongi, unfortunately, maybe the network. Whilst we are waiting for him to return, I think Clifford from Namibia can start, and then we give Bongi a chance again when he gets in.
Well, thank you very much, and good morning again, everybody. Well, I was so caught up in Bonge's talk because he was unpacking everything regarding intimate partner violence, and I was even about to put on the chat box to say that Bonge is preempting everything that I have to say, literally, because he really went into the depth of it. But coming to talk about in drivers, because we are looking at the drivers, and when we talk about drivers, especially around violence, and I want to use the term violence because intimate partner violence is just another form of violence perpetrated upon a gender, opposite gender, either because of power, of knowledge, or economic strength, which also is another those are other drivers that I can already mention when it comes to intimate partner violence. But I think, and I always like to use this statement that the drivers of a driver of something, or the root cause, not a driver, a root cause of something, a root cause of a problem is always triggered or driven because of lack of understanding. We can never, that is the main cause. Lack of understanding, and lack of understanding comes with lack of quality, available, domesticated, community-based information. It comes with alcohol and drug abuse. If you look at urban areas in each country, developed areas, or developing areas in many countries where access to alcohol is everybody have got access to alcohol, or is easy. When it comes to drivers of intimate partner relationship, it comes with harmful, something that we can never remove and never exempt when it comes to violence or drivers of violence, whether it's gender-based violence, intimate IPV, or sexual gender-based violence, is harmful traditional and cultural norms, and that couples or encompasses societal norms, because the norms in society are derived from the norms in the traditional norms and cultural norms in different cultures. But like I said, it comes with an understanding. We have to understand first that violence, whether it's intimate partner violence, gender-based violence, sexual gender-based violence is a violation of a human right. That's what this one thing that we have to understand. I think is very important that even when we talk about the drivers, we need to understand what are we talking about. It's a violation of human rights that denies the dignity, or denies the dignity of a human and individual, and hurts the human development. So everything that denies human dignity, one, of an individual, and hurts the human development is classified as violence. And I highlighted that because like Eswatini, if we look at Namibia, looking at our studies that we have done, I'm referring to the NDHS, the National Demographic Health Survey that was conducted in 2013. If you look at Namibia, according to the NDHS, a third, like Eswatini, a third of women have been beaten or forced to have sex or have been psychologically abused by their husbands or partners. 15% of Namibian women have experienced violence, or who have experienced violence have never sought help. That is just violence. Whether it's intimate partner, whether it's GBV, never sought help. I'm just highlighting that because I want to come and unpack it. According to the DHS, Demographic Health Survey, 33% of ever married women between the ages of 15 to 49, take it to 50, have experienced physical, sexual, and emotional violence from their partners. So, the drivers of intimate partner violence are, or they are motivated by, power over. I like calling it power over, because power over can be recognized as financial power over another partner. And I'm saying power over because I don't want to push intimate partner violence only towards a male partner, in a female partner as well. And it can be in a female partner when you talk about power over, when a woman is earning more than the partner, is earning more than the husband. It can be power over when the woman is more educated, and that's where you find psychological violence perpetrated, or emotional violence. So when a woman is more educated, and we have all seen, if you look at our studies, we've seen that violence decreases with increasing in the increasement of knowledge. The increasement of knowledge decreases violence, especially towards intimate partner violence, or towards women, when it comes to women. And I'm saying this now because if we look in the past 20 to 25 years when we have been advocating, and I'm going to be a devil's advocate a little bit here. Yes, I advocate. I'm a feminist. I advocate for the empowerment of the adolescent girl and young woman to be brought up in a safe system. And I'm going to come to the system also. So if you look at the past 20 to 25 years, the world globally, the global village has been empowering the adolescent girl, or the girl child, which is a good thing. But in empowering the girl child has not only been protection, it has been in economic empowerment, it has been in knowledge. If you look at the number of graduates in Namibia, you will find that the girl child is graduating more than the boy child. That should already send a question mark. It should already give you an alarming platform to say what's happening here, because a lot of because of the boy child being left out, programs, systems, the system is not really providing the space for the boy child anymore. It's not really advocating and addressing the boy child's needs. So we also have intimate partner violence that is being perpetrated by what always we have known as woman, because of knowledge, power over, because of economic empowerment. She's earning a bigger salary than the guy. Because of status, she's a director, and the guy is a police officer. She's a minister, and the guy is the husband is probably a deputy director somewhere, or he could even be in the same ministry. So power over, education, which is motivated by education, economic empowerment, and obviously knowledge. The more knowledge you have, the more knowledge the partner has. Then obviously that those are one of the drivers of intimate partner violence. Traditional harmful cultural norms, we can never ever leave this out, because society today, and I'm gonna say this is my own personal point of view, society today is being corrupted by by traditional cultural norms. Society today is being ruled or is being controlled, that's the word, by traditional. In Namibia, and I'm referring to the Namibian context, the biggest struggle we have and why we are failing even if to do away with issues around intimate partner violence. If I even tell you how many studies have been done in Namibia when it comes to intimate partner violence, what are the channels, how serious it is, what are the commitments committed towards intimate partner violence, not gender-based violence where there is evidence, intimate partner violence, or not physical violence, rather, not physical abuse, but intimate partner violence, which obviously can come with no signs of bodily harm or bodily damage. This is one of the drivers of this is traditional cultural norms, because we did not draw a clear line between the constitution and customary law. Constitution law and customary law. The line is not defined because you still find in different communities where the traditional court has more power than the constitutional court, where woman is being abused and the matter is taken to the traditional court. And when the matter is taken to the traditional court, the headman is the judge, the prosecutor of that court. And if the headman rules according to traditional norms or practices, the victim will never get the help that she wants to get or he wants to get, especially when it comes to women. Women never get the help they want because the traditional court will always rule in favor of the men, which comes to what Bongi has alluded earlier when we are talking about issues around patriarchy, gender roles, where the man is supposed to be the head, where the man is supposed to have the last say, where the man is brought up to believe that it is justifiable for a man to beat his woman for a reason. It's accepted for a man and justifiable for him to beat his woman for a specific reason. That reason could be food that is cooked that he doesn't like. That reason could be she's wearing a skirt that he doesn't like. That reason could be she was talking to a neighbor and he doesn't like it. And the traditional court rules in favor of a man because it then takes it as, first of all, like we said, patriarchy. You belong to the man has got the woman belongs to the man. Secondly, the woman is not supposed to do what she wants without the man's permission. So traditional and cultural practices, they are playing a key role. And they are playing a key role even if you come to members of parliament, politicians, they are playing a key role. We have homes that are broken today because of cultural practices, where you are unable to seek help because you will bring shame to the family. If you look at a lot of royal families in many countries, we call them royal families, prominency, status, where you live in a house, you are married to a minister, and you are being abused, but you cannot take the matter out into society because you are going to bring shame to the family. I think Bongi has spoken about this as well. How is the society going to react that the minister of so and so is abusing his wife? And we had many cases. We had many cases whereby men have gotten away with cases. Perpetrators have gotten away with cases, and because of their status, recently in Namibia, and I'm gonna say this, recently in Namibia, we young people were very angry, whereby one of the executive directors of a ministry, and the worst thing, it's a ministry that represents young people, youth, has recorded a sex tape while he's having sex with one of the ladies. And this tape went viral. And we wrote a petition. We asked for government. We asked for the president to intervene. We asked for the ministers to intervene to remove this perpetrator, this individual from the position. And the worst thing is because he's representing a ministry that advocates for young people. That's the custodian for young people. The matter was looked into. The action was never taken. But the person that was shamed more is the lady. Everybody started investigating where this lady works, what she does, and everybody started pulling out what her past life has been. But nobody ever went after this individual that was responsible, without the consent of the lady, was responsible of recording the video, sharing the video of his friend for it to go viral. The lady today, she cannot walk freely in the street because the system is broken. This guy is continuing with his work. He's still serving the same position. Nothing was done against him. And this is then what breaks the system. This is then what discourages a lot of people to even seek help, a lot of survivors to seek help, a lot of victims to seek help, because the system is broken. The system is not there for them. The system is not sensitive enough. And I'm saying sensitive, it's not sensitive. There's so many loopholes. It's not sensitive enough to address the issues around violence. If you go to the police station and say you are being violated financially or psychologically by your partner, they will look at you and laugh at you. They will look at you and laugh at you because they don't understand. Lack of information, community-based information. I think from my side, that is the drivers of intimate partner violence that we mustn't really, really overlook. It's lack of information. And I'm going to emphasize, I'll keep emphasizing on lack of information, because with information, you inform the policy makers about the sensitivity and the seriousness of this type of violence. And if we do not have that information domesticated, if we do not have that information, that information conveyed through conversations, because one of the things is conversation. We do not have conversation around intimate partner violence. There's no conversation. And as long as we do not have conversation around that, we can never get to the root cause and address the root cause, because there's no conversation. And when there is conversation, there is action. When there is action, there is change. Last year, the Namibian young people, we got very angry because of issues around gender-based violence perpetrated towards young people. The justice system is not strict enough, it's not sensitive enough to address these issues. And we protested. We went to stand in front of government buildings. The National Parliament is one of them, when we called for a shut it all down protest, that every ministry must be shut down, every government agency must be shut down, because we want our voices to be heard. This year, the President's State of Nation address came out very strong in regards to if there is no peace, there is no development. And he was referring to the shut it all down protest that we had in Namibia last year. We drove as young people. It was driven by young people. And we were very happy to hear in the President of State of a Nation address that is addressing the issues around gender-based violence. But still, we believe that is just addressing that. We believe that is just calling out. We still need to bring information to the policymakers. We still need to bring information to the decision makers, because lack of information today and how serious and what do we look at, what is intimate partner violence, I think when you clear that, we are able to close, or to at least narrow, not to close, but to narrow down the drivers of gender-based violence, or identify them for that matter. And the conversation obviously is something that always changes the community. From now on, from my side, this is what I have to say for now. Maybe Bonge is back, that I can allow him to join in. But I think I have highlighted, and I'll repeat again, obviously a common driver, alcohol and drug abuse, harmful and traditional cultural norms, power over, as I've mentioned, that comes with education, economic, and obviously information. Lack of information, very much I emphasize on that. Thank you very much.
Thank you, Clivet, for that mouthful contribution. Apologies, colleagues, was cut out by the internet this side, but now I'm back. I'd love to appreciate the contribution from Clivet, and I also appreciate the comments on the chat box, and I will promise that we will respond to questions. I can see questions on the chat box. I would love to request everyone who has a question to continue, write those questions on the chat box, and we will respond toward that. At this point in time, I'd love to invite Alice and Andrew Moyo to take us through as to what are the loopholes in terms of in our systems in addressing issues of intimate partner violence. Alice, you will go first, and then Moyo will then follow on.
Thank you, Bongi. Thank you, colleagues. Yeah, something that Clive had mentioned in the drivers for IPV, especially in the Namibian context, is the issue of gender harmful norms. Now, with the gender harmful norms, in the system that is supposed to address IPV in Namibia, the human capital in the system are members from the communities who practice the gender harmful norms, the communities who instill this personal belief in the individuals that carries the harmful gender norms through. So for us in Namibia and in the work that we are doing, specifically with Lifeline, Childline, where we do a lot of community-based interventions, we have found that number one, lack of knowledge, and also the fact that victims of IPV, GBV, VAC, they do not feel empowered enough, they do not feel confident enough to access the services out there. And that is simply based on the fact that one or two from the community members have tried to access the services, but unfortunately have been met with a not so inviting environment for victims of these violent incidents. You would find if a married woman, for example, goes to a police station and wants to lay a charge against her husband that has been physically abusing her or emotionally or sexually, the personal beliefs of the law enforcement officer would overrule what the law dictates. So the police officer would not be inviting enough to let the victim continue, and would often make remarks like, you are married as married couples, You need to sort that out. Go and sort your marriage out. It's not for the court, it's not for the police. Secondly, in my opinion, and it also came to light with the Shut It All Down movement that Clifford was mentioning, that happened in Namibia last year. We could identify that although we are expecting from stakeholders and service providers to render the necessary and quality service to victims of violence, they do not have the skills and capacity to do so. At our GBV unit, Gender-Based Violence Protection Units in Namibia, often than not, when you go into the regions, you would not find a social worker stationed at the unit. But our Combating of Domestic Violence Act 2003, 8 of 2003, makes provision for social workers to be on site, to be able to give immediate psychosocial support for victims of violence, whether it be GBV or IPV. You would also find that when a victim comes to the police station, the basic knowledge of counseling or psychology is not present. The way the police would react to the story that's been narrated to them can actually cause more harm than anything else, or add to the harm and the trauma that the victim is already suffering from. There is also another loophole in the sense that, again, at grassroots level, the issue of accessing counseling services, most of our grassroots level communities still see that as a taboo. They think that if you go for counseling services or psychosocial support, then you have a mental disability, and they call you crazy, and they call you must go to a mental institute. So even there is a huge loophole for us working in the communities to change the mindset of the ordinary community member, to let them know, and it's an ongoing process, it can never stop, to let them know that if you reach out for counseling, for example, there's nothing wrong with you. We need to when you go to the police station and a police officer is not giving you the services the way it should be, that you have the right to lodge a complaint. But instead, we would just go back home and continue to suffer in silence. The same demographic and health survey, the Namibian one of 2013, says that 14.9% of survivors of GBV sought help from the police at any given stage, but 15% did not even bother to seek help from the police or from a social worker, etc. If there are physical scars, they would go for medical services, but that's about it. They don't pursue it further, because the truth is our systems are not victim friendly. Our systems are not inviting for the victims of violence, whether it be IPV or GBV. That is it from me for now.
Thank you so much for the presentation from my colleague. This is interesting to note that we are faced with almost similar challenges, and in terms of us addressing the issues of IPV, it will be we will not be doing justice if we do that without engaging the community structures. sorry for that interruption. Sorry. Yes, in terms of the as we engage the community structures, there are loopholes that we are identifying, and the gaps that are there. In some of the initiatives that have been conducted, we have seen a number of initiatives that have used community leaders as just entry points. So the what we do as MenEngage Eswatini, we have gone beyond that of just seeing the the traditional leaders and the religious structures as entry points, but we use them as partners in terms of engaging them. Maybe first of all, before I get to that point, let me first of all identify the gaps that we have in Eswatini. The biggest gap that we have is the dual legal system that we have in addressing the issues of IPV, especially when we look at the traditional law or customary law. We have the Chief Justice as the king. As the king himself. So when it comes to the Roman Dutch law, the Chief Justice then reports to the king, and so that on its own, we have seen some of the cases failing to go through the court processes, especially with the Roman Dutch law, and you have seen those cases withdrawn to the traditional or the customary law, where some of the things will be considered, where some of the cases will be considered as customary, and when they are considered as customary, so that will then give immunity to whosoever the perpetrator is. So that has become a huge gap that we have identified in the fight against.
Thank you, colleagues, for these important contributions around the issues of the gaps that are there and the loopholes. And it is to emphasize that in the context of Eswatini, you find that even in terms of when they put measures in place, like the new laws that are being adopted, you find that it will take time for government to put regulations in place that will enable the usage of that particular piece of legislation, and also that can even enable the courts to prosecute such matters, because there are no regulations that allows that particular institution tool to be used by the court. You find that in a number of cases, we've seen a lot of cases that are being withdrawn from the common Dutch law to the traditional laws, and also most of these cases, they happen within the family structure, whereby in most setup within the country, cases that happen within the family setup, they are easily associated with the customary law. So which is the huge gap. And also, another gap that we've seen is that, the contradictory laws, you find that a certain piece of legislation will define a child as someone below the age of 18, and then in another piece of legislation, you will find that a child is defined as someone below the age of 16. So those contradictory laws, it creates a room for people to be violated within the law. So those are some of the challenges that we see around in terms of the systems that we are working under in our respective countries. And then you find that, in terms of the loopholes again, there are no, even in terms of our various institutions, we do not have policies that will compel anyone associated with that particular organization to abide to certain standards, to non-violence, to act in a non-violent manner. Because it's an honest truth that you find that those same perpetrators of violence are the same employees within our various sectors. So without putting those measures in place, those strong policies or important policies in our work environment that will compel them to even act in a non-abusive manner, even in their private lives, it tends to delay or it limits the effectiveness of those particular laws. And also another part is that you find that even whenever those cases are being reported, like in the Kingdom of Eswatini, recently we've seen a relative of a High Court judge raping a 16-year-old and impregnating her. The same officer of the law is the one who's been going there trying to influence the judgment of the magistrate, and also even going into an extent of going to the police station where that perpetrator was incarcerated, asking for his release and he was released to his custody. And then a lot of noise was being made around that issue. So there's too much immunity for these perpetrators of violence, and also those people who are in power. They are also they go with a lot of immunity that makes them feel like they can do anything anyhow. So with those contribution, colleagues, I think now we need to then tackle the key part. In Andrew Moyo's presentation, he did touch a bit on the aspect on the key stakeholders. What are the gaps that are existing when we engage key stakeholders like those he mentioned, the traditional leaders, as well as the various key stakeholders in our respective countries. So let's zero in around in terms of what are the gaps in engaging those key stakeholders, and how do we then close those gaps? How do we then address those gaps and ensuring that we deal with issues of intimate partner violence? Because, colleagues, we cannot eradicate intimate partner violence by only working as few individuals. It needs to be a multi-sectoral approach. We need to engage with a number of stakeholders. We need every stakeholder to take it into action, to take action and take a stand around issues of intimate partner violence. Clive, can you help us in terms of, in the context of Namibia, can you share with us what are the gaps that you've identified and how are you addressing those gaps in dealing with stakeholders? Thank you. Clive, can you hear me? Or Alice, can you chip in terms of, in your context of Namibia, what have been the gaps in dealing with stakeholders and how are you addressing those gaps?
Yeah, thank you, Bongi. Before I respond to your question of the gap, in your previous statement, you mentioned two things that I think for Namibia that we also need to highlight. The one is the provision in the different laws, if I remember correctly. Now, Namibia, in the Combating of Domestic Violence Act, we have provision that any person that witnesses acts of violence being perpetrated against someone else has the legal responsibility to inform the police or the authorities However, the truth on the ground is that people will tell you, I cannot get involved for fear of retaliation that may come, etc. Secondly, and I'm moving into engaging stakeholders, the issue of people of authority that are seen and perceived as untouchable. Last year, with our Shut It Down campaign, our own Minister of Gender, she made a media statement and she said that she basically blamed victims of violence for withdrawing cases at court. And she threatened them and said that should any victim of violence, GBV, VAC, or IPV, again withdraw a case at court, they would be jailed. And that in itself caused another bomb to explode in the Namibian society. Now, if you have a leader in position, and for that matter, the Minister of Gender Equality in country, who is supposed to drive the engagement of key stakeholders to combat GBV and violence, the incidents of violence in our country. Now, if statements are like that are made in public, then it already gives you a picture of how difficult it is at times to engage, especially with our partners from government, the respective ministries. However, as a CSO in Namibia, I think we have the basic challenges to engage stakeholders. Number one, with government. Time is always an issue and they are always very occupied with other things. So to get government stakeholders on board remains a big challenge, regardless of the urgency of the engagement that you want to take at that specific point in time. Number two, even in the CSO world, you would find that we prefer to work in isolation. I do not want to work with the next organization or the next stakeholder simply because I don't want to work with them. The issue of a holistic approach is a far-fetched dream, in my opinion, or consolidated efforts, because you would often find that stakeholders are not willing to share platforms. We do make progress. We have engagements that work. For example, we have a human rights and GBV cluster in Namibia, and that comprises of government ministries, representation, CSO, NGOs, faith-based organizations, etc. And we meet quarterly to really have a look at the achievements over that specific period, challenges that we experience, and how can other stakeholders of the cluster, how can they assist in addressing the challenges. So that is one of the mechanisms for us that are working really. From ground level CSO, with our partner organizations, we have constant monthly partners meetings. But again, I cannot stress it enough when it comes to the availability of government at times, then we are left hanging. So government commitment is a gap for us. Service delivery from government, because if you refer victims to a government service, oftentimes they would be met with an excuse that unfortunately we cannot assist. There's no cars at the police station, there's no medicine at the hospitals, There are no doctors available to address you now. So the resources from government side also contribute to the gap in the engagement of stakeholders, in my opinion. I would for now leave and give Bongi or Clifford a chance to continue. Thank you.
Thank you, Alice. I don't know if Bonge wants to mention something, but maybe I can allow Bonge just to reiterate on the question that because I was almost getting disconnected, and I could just hear him saying Clivert, and then I heard you jumping in, so I didn't really hear that part. But maybe Bonge can just say what you were saying, so that I can just quickly just add and amplify what Elise said regarding the loopholes.
Yeah, thank you, Clive. I was requesting that you share in the context of Namibia in terms of the gaps in engaging stakeholders. So I was requesting that you enlighten us in the context of Namibia to say what are the gaps in engaging stakeholders. But Alice has already shared on that. I'm not sure if ever you've got anything, just briefly to add on what Alice has shared around engaging in the engagement of stakeholders, and then Moya will then add on what are the gaps in terms of engaging in the engagement of stakeholders in the context of Eswatini. Thank you.
Thank you, Bongi. Not to be long, just to briefly and amplify what Elise was saying. And I'm very happy that Elise unpacked everything. You literally went to the grassroots of the conversation. But there is one thing that we always believe in, and I don't want to say we believe in, and something that we must focus on, something that we are not really addressing, and that is meaningful, authentic partnership, meaningful, authentic interventions, meaningful capacity building, meaningful resources. When I say meaningful resources, it means the resources must be equitable and must be used for the intention or the purpose. Biased social contracting, that is a gap. That is a serious gap. I don't know if it's only in the Namibian context, because of that, and all these things that I have highlighted, we do not have meaningful coordination. Because for me, the gap or the umbrella for coordination should be called, to fill up this gap, for the umbrella to fill up this gap, to close the gap, should be meaningful. If the partnership is not meaningful, which means we need to look at partners and what are these partners doing. We have so many, and I'm not against civil society organization, but we have so many pop-up, I call them pop-up civil society organization or NGOs. Everybody wants to do something. Everybody wants to address something. Everybody wants to be part of the food chain, which is a good thing. But we are not looking at not duplicating, because I feel like when it comes to the mandate, the vision and goal, a lot of people duplicate vision and goals of different organizations just by tweaking and changing different words. And then somebody wants to be a civil society organization. And I feel like this is not done meaningfully anymore. Want to survive. They are looking for employment. They are looking for money in the pocket, which is not a wrong thing. But when we're talking about meaningful interventions, if we are not looking at civil society organizations that have got a meaningful goal, the interventions will never be meaningful. meaning the resources will never be used for the purpose that is intended for. Coordination, it must not be biased, like Elise was alluding earlier, that you find either government, this even now happens at government levels, where you have people who have become friends and they will say, no, we want to do this type of project, but we do not want Lifeline to be part of it. We do not want MenEngage to be part of it, for instance. Biased coordination, that is biased coordination, biased social contracting, and organizations that are having meaningful interventions are then left out. So for me, those are the gaps. And obviously, what Elise has mentioned when it comes to government, I think capacity building is very much needed, especially when we are talking about under the context of gender-based violence, intimate partner violence, sexual gender-based violence. When it comes to law enforcement and capacity building of lawmakers and people in high places, that is something that's very much needed, from traditional leaders to gatekeepers to local authorities. It's something that's very much needed. And that's what I call a meaningful coordination. I think I'll pack it here for now, Bongi. Thank you.
Thank you so much, colleagues. Maybe those that were not yet in when I introduced myself. My name is Andrew Moyo from Eswatini. Part of the stakeholders, the key stakeholders that we engage as that we have engaged and we continue to engage as MenEngage Eswatini is the traditional leaders. And in engaging traditional leaders, let me talk to them combined, the religious and the faith and traditional leaders. There are a number of gaps that we come across, and part of it maybe on a lighter note, the issues of IPV and the issues of let me say the issues of information. There's lack of information with regards to the issues of IPV. To some extent, that you find even faith leaders to some point are demonizing the issues of rights and calling it an antichrist, and also some of the traditional leaders blaming the issues of rights to making people ungovernable. And so those are some of the challenges that are there, and all that is driven by lack of knowledge. But what we've gone to do as MenEngage Eswatini is to not to use these leaders just as entry points or not see them as gatekeepers, but we want them to be partners, to partner with us in issues of addressing all forms of violence, especially the issues of IPV that is very much in the rise, because their engagement will strengthen the community ownership of the initiatives that we are doing, and also it will also form part their strategy. The strategy will form part of the community development agenda. Whenever they address the issues of community, they will not address them without mentioning the issues of IPV, and that also that strengthens, or it widens the scope and strengthens the support system of the survivors of IPV. Because at the end of the day, we want to see these leaders taking an initiative to say, in our communities, we do not want to tolerate any form of violence. And the success stories on that, we have seen the commitment from other leaders, who, especially the community leaders, who will say, who have come up with a resolution to say zero tolerance to violence in the community, to an extent that even if in their community committees, because there are community structures that work with the leaders, with the traditional leaders at community level, to say if any member of the committee at community level is implicated for any form of violence, that member will cease the membership from the leadership of the community. So the membership will be terminated as a community member in the community. And also, if there is a person who is implicated for any form of violence, that person will not be elected for any committee in the community. So that to us, we see it as a success, because at the end of the day, it strengthens or broadens the support system, especially for the survivors of violence at community level. And also even the faith leaders. The faith leaders have gone to some faith leaders have even gone to an extent of committing to say they will not shield any perpetrator within their church. So they are working in partnership with the legal system, so that with the justice system, so that whenever there's anyone who is implicated for any form of violence, they will allow justice to take place. So those are some of the successes that we have realized as MenEngage Eswatini in our engagement with the stakeholders. And also we have forums. We have created forums as MenEngage Eswatini, where we engage even decision makers on issues of IPV, and even also engaging the partner NGOs who are some of them are the members of MenEngage, and some of them are not members of MenEngage, but they are part of the civil society. So we have forums where we engage the civil society, policymakers, law enforcement agents, and all the structures in terms of strengthening the initiatives towards addressing the issues of IPV in the communities, and also sharing the practices that we learn, because through the MenEngage study, there are a number of initiatives, a number of gaps that we've identified. The study that Bongosi spoke to and Bongosi unpacked. So through that study, there are a number of cases or a number of gaps that we have identified that are very important in sharing with the key stakeholders in terms of moving forward in an endeavor to curb IPV in Eswatini.
Thank you, Andrew, and thank you, colleagues. I think what is also worth sharing would be that as MenEngage Eswatini, we are working in ensuring that we have services for all community members in the country. You know, in terms of some services, you'll find that in our service provision, our services are kind of discriminatory, for lack of a better word, to say they are only suitable for a certain group within the society. So we've taken it upon ourselves to make it a deliberate action that we also engage all the community groups within the kingdom. Like we are also engaging, we've made a deliberate move to ensure that in our conversations around addressing these issues, we engage even the LGBTI community, because you will find that due to the forms of discrimination that still exist within communities, they will be left outside around them accessing services that are in relation to issues of intimate partner violence. But then, as MenEngage Eswatini, we've taken it upon ourselves to ensure that we, in any intervention or in any engagement that we do, we make sure that they are part and parcel of our conversation. And also another gap that Alice touched on the issue of resources, that the issue of the resources, gaps on resources from the government side of things. You'll find that government will complain of them not being able to to have cars and they don't have fuel, even when you refer a case of a client to them, and then they are not able to attend to that case because of the fact that they don't have fuel. So as stakeholders and some of the members of the MenEngage network, they are making it deliberate actions and putting it upon, taking it upon themselves that they also provide those resources. They share their resources with the other stakeholders, not only government, but with even with the other NGOs, because our key, our amongst other objectives of as our country network is to make sure that we promote our network members to share resources, because we cannot eradicate the partner violence as individual organizations, but through collaboration, we'll be able to achieve a lot. So we even share resources. You'll find that whenever we are to attend a certain matter, maybe there is a certain case and the police do not have transport, and then we'll just, a member of the network will just provide transport for that particular police station so that they can be able to attend to those services. And you find that, you know, some of the services needed by maybe rape victims or rape survivors, they are so much expensive and they cannot be provided within the government facility, health facility. So some of the network members will go to an extent whereby they will also pay for those services within the private, from I'll secure those services from a private practitioner on behalf of that survivor. So those are some. That's how partners and stakeholders in the Kingdom of Eswatini, they are working around closing those gaps that currently exist within the society. And as Moyo have highlighted, um, amongst the gaps that within community level, you will find that organizations, when implementing their services they, in the communities, they will be only available from an area of 8 to 5, as well as from Monday to Friday. But then on weekends, in most cases, you find that IPV happens, you find that it happens when everyone is back from work, which is after 5 and then till morning, between 5 and 8 in the morning, afternoon to 8 in the morning, and then you find that it will happen on weekends because they are at home. So there will be no support system for those survivors of intimate partner violence within that community. So then now, the to cut that gap, stakeholders in the kingdom, they've also engaged them, they've also engaged the community cadres to put structures in place like we have rural health motivators, we have community groups that are set within the community. So the stakeholders or network members, they train those community structures so that they are well capacitated to address issues of intimate partner violence, to provide the right information, because you find that even if those cases are reported to those community structures, they will still be addressing them based on the embedded socialization within them, which is then exposes those survivors of intimate partner violence to secondary victimization or secondary trauma. So that's how, as a country, we deal with those gaps that exist. But then, what we normally do, and which is at the prime of our roles as a MenEngage Eswatini, we do not just engage them as entry point, or we just send information, but then we make it upon ourselves that we make sure that we are always on capacity building. We look at it from a capacity building point of view. We build capacity, we ensure that we build capacity. That's why we even took it upon ourselves as a network that we do a study that will provide a baseline information on the intimate partner violence, on what drives or perpetrate intimate partner violence in the country, so that we share with our partners, so that we influence, that we inform programming on issues of intimate partner violence, not at national or at a stakeholder level, but even at community level, so that even communities put systems in place that will address issues of intimate partner violence, and also ensure that uh, issues of addressing gender-based violence and any other social issue, it is regarded, or it is seen as a developmental issue at community level, not as just something as a by the way. Whenever they talk about any development that they want to see in their country, we want, or in their community, we want those communities to put it in, to be part of their conversation, to say we want a violence-free society, to say we've developed as a community. We want a community whereby we'll see no case of gender-based violence or intimate partner violence. Thank you, colleagues. I'm not sure if ever our colleagues from Namibia have got any reaction before we move on to the final section of this conversation around the successes. What do we see? What are the improvements that we see in our respective countries? But then I'd love to open for reactions from our colleagues from Namibia, if ever there's anything that they want to add before we move to the set of the successes.
Yeah, Bongi, if I may,
At
also
least,
okay,
yeah, I
let
insist
my
to
chair go away.
I insist to go first, at least because I believe with the organization, the secretariat, you are able to wrap it up very well. Because Lifeline, where you are from as well, is also um, the front line when it comes to entry points of reporting um, violence perpetrated against partners, especially intimate and gender-based violence. In Bonge, in Namibia, like I said, I'm gonna leave the data to Alice and all the other nitty gritties. But in Namibia, what has worked so far already, I think the fact that we are able to have a conversation around GBV, especially or intimate partner, a conversation around violence, sorry for GBV, around violence, especially amongst young people and among partners in developed areas of the country or developed societies. We are able to stage a conversation. We are able to talk about issues perpetrated or violence perpetrated against victims. The fact that I've seen in most of the civil society and government, and also being addressed by uh, the national strategic framework, the issue around violence has come out very strongly. But one of the points that I want to highlight, and just to wrap up, I think what we have seen that the cry has been heard, and the response of the president in the national, the State of Nation address is clearly indicates what has worked, and especially when it comes to GBV, clearly indicates that the cry out, the conversation, the pushback from the society regarding violence perpetrated, that I think is something that we can maybe say we can call it as a lesson learned. We can call it as a change, or shift from where we were to where we are going now, and where we are. But let me allow Elise to emphasize and wrap up on this one.
Thank you, Clifford. Yeah, colleagues, I am very pleased to share with you that in Namibia, besides the engagement at different levels that Clifford has been referring to, that more and more the talk of town became the men and boys engagement, because they are perceived to be mostly the perpetrators of violence. So we have different programs from different NGOs and CSOs in Namibia that speak to men and boys with the aim of addressing the issue of violence against women and children specifically. So with that, what we have learned as a lead organization, as Clifford has called us, is whenever the opportunity comes along to submit proposals and look for funding, we make sure that we cater for GBV and gender and violence in that proposal. Because I've already mentioned that our government, when it comes to resources, it's very limited, and we are trying as citizens and as stakeholders to take up that responsibility to support the government where government cannot fulfill. Also, the fact that as Namibia we have a national plan of action against GBV that comes to an end in 2023. It's a 5-year plan that comes to an end in 2023, and currently that plan is being reviewed by government and by other stakeholders and doing costing, because there is in the way, or there needs to be change in the way how we try to implement this plan against GBV in country. So constant reaching out to government has at least proven successful for some of our efforts, because they would allow you into their system, they would allow you to assist them with capacity building. For example, Clifford has been training a lot of government officials, and then other NGOs in Namibia as well. What also worked for us is the fact that more and more the youth is becoming the voice in our country, and people do not have a choice. They are listening to the youth in country. So yeah, working together with one another, consolidating our efforts, not working in isolation, and promoting the transformative gender approach, engaging men and boys specifically in our country, are some of the lessons that we've learned that are working, but also is still a work in progress, because we are trying to improve on that every step of the way. Thank you, colleagues.
Maybe Bongi, please, your permission, just to allow me to emphasize on the notes that Elise has made. I think this is very important not to leave it out regarding the youth becoming the center. The youth is at the center of gender-based violence, or when it comes to violence in the country. As we speak right now, we are celebrating the National Youth Week for Namibia. I have been part of the task force since February, and it's been hosted by one of the government entities, which is the custodian of all youth-led organization, the National Youth Council. And yesterday, my colleagues, because I'm not in the capital now because of other issues that came up, but my colleagues together, our team, we had a parade from one of the local areas to the GBV unit with the support of the law enforcement Obviously, the meeting was opened, or the launch. We actually launched yesterday the National Youth Council that was launched by the Minister of Gender Equality. And at the GBV unit, I'm going to share it later on yesterday. Of course, we had been planning this with the authorities at the GBV unit, but we've managed to finalize. We painted a wall with a message to the community about gender-based violence, how committed the GBV unit is going to be, that they are going to listen to to society and to the victims of gender-based violence. So we painted a wall yesterday that looks beautiful. I'm going to share it. That's one of the things that we have done. The theme on gender-based violence, or not the theme of not gender-based violence, but the theme of the National Youth Week is Youth Ignites Against zero tolerance on gender-based violence. Youth ignites against zero tolerance against gender-based violence. Sorry. And tomorrow we are having what we call the Slut Night. Today in the afternoon we are hosting a men's conference. There is one that is happening in one of the local areas where of unreported cases are found, especially in the city, in the Havana constituency. And in the afternoon, we have one that's happening uptown, where we have even the speaker of the spokesperson of State House. The presidency spokesperson is going to be part of this men's conference that is taking place today at 4. I will look, I promised Josephine and some of the other colleagues that will share the link on that. And tomorrow is, we are, as we call it, we are saying it's a slut night, where literally we are trying to demystify and to break down the stigma and discrimination around the term slut, especially when it comes to our young girls. So we are hosting a slut night so that women should not be judged and should not become prey because of what they wear and how they dress and all that. So tomorrow we are hosting the Slut Night event, and that has so far, I don't know if Elise has seen it, has raised so much conversation, so much eyebrows, so much talking within the country. And this is what we want. We want people to be part of the conversation. We want people to come with their opinions so that we address their opinions. So this is what's happening in regards to the response when it comes to GBV in the country and addressing all issues around SGBV and intimate partner violence. Thank you very much, Ponky.
Oh, thank you, colleagues. It's so interesting and it's so encouraging to know what is happening in other countries. And also, that's the whole idea or the whole aim of this session, that we learn from what is happening for other countries and also move toward in terms of adopting and implementing them in our respective countries, and adopt it and domesticate it to fit or to suit the context of our relative countries. Thank you, colleagues. With those contributions, I'd love to invite my fellow panelists to share their successes in terms of, based on all what they've shared, and what are the promising trends that they've seen. I think for this one, I will strictly request that we only spend about 5 minutes just to briefly share those successes, lessons learned, or what works, and then we move straight to questions. I've seen, and I think, if not mistaken, I've seen 2 questions from the chat box, and also I'd love to request other colleagues to also share their questions on the chat box, because we'll be responding to them shortly. I'd love to invite either Ellis or Clivet to share their successes. What are the things that they are learning from those activities that they are sharing?
Okay, thank you, Bongi. From my side, engaging with men and boys at different levels with different community interventions, we are starting to reap the fruits of those interventions, albeit on a small scale. Constant engaging with community members and community leaders because instead of going to government service providers or other service providers, most often they're not, communities would engage with their local community leaders. And I'm glad to share that in one of our programs, we make specific provision for capacitating community leaders in identified communities to be able to support their communities in the fight against GBV and violence. Thirdly, to always be ready to engage and support when the call comes from government. The meeting I was telling you about, where the National Plan of Action is currently being reviewed, also came about after the shutdown movement last year, where government, because of the demands that were made, so they called all the stakeholders, NGOs, government, etc. They called us for a very urgent meeting, and we had to make recommendations to government on how they can address. And hopefully that would feature in the national plan that is currently being in review. So those three for me, they are not perfect, but again, slowly but surely, we are seeing the results of engaging men and boys, of engaging community leaders, and also engaging government in whatever efforts we are trying to curb violence in Namibia. Over to Clifford.
I think at least you have preempted everything so far. You did really do justice to the question that was posed to us from Bongi. Maybe just to add that there are concurrent and consecutive trainings that are happening around the country from different stakeholders when it comes to the GBV cluster and advocacy around gender-based violence, targeting decision makers and politicians. So we had so far two in the country, and this is a very strong engagement. Myself, I was part of the one, and specifically my topic was intimate partner violence and concern on capacitating the staff members of the National Youth Council together with the Ministry of Youth. So you can see, like I said earlier, the conversation is what we need. We need to be able to talk about this freely without any stigma and discrimination, and literally unpacking and dismissing the myths around issues when it comes to violence perpetrated against the victims, and changing behaviors and stereotyping, and also obviously societal norms that are enforced or imposed, not enforced, but imposed by society on men and women. So that for me is a good response. And I also just believe with I'm very touched by the president's speech when he really spoke about GBV. And I know this is just the beginning of the conversation amongst Namibian community, especially for decision makers. Bongi, over to you.
Thank you, Clive. With this time, I think maybe I'll just only spend a minute highlighting maybe the successes or what we see to be working in terms of our interactions in the Kingdom of Eswatini. Mainly with the use of the referral mechanisms in terms of we're having those multi-sectoral meetings, referral meetings with the various stakeholders. We've seen now a move towards an increase around the referring of cases from one stakeholder to the other. And also we've seen now a growing political will from the government department around engaging other stakeholders and also making use of other services even that are available from the NGO sector, because you find most of the time you will find the government department and other forums fighting around in terms of providing services, and also they will find a lot of competing stakeholders competing with each other. But through the engagement and the working around the referral mechanisms, you see a lot of collaboration, and also with other interventions that are being introduced or that are being done across various communities and the engagement of traditional leaders. We now see them inviting various stakeholders to come and implement in their communities or engage in various issues. And those, whereas before you will go there trying to penetrate those particular communities, requesting for permission to do a certain activity. But now, them themselves and communities, they invite the stakeholders to come and implement, because now they see the importance of these initiatives that we are requesting to implement or that we are implementing on their communities. And you find that organizations, they will be invited to do trainings or to facilitate or be religious gatherings, be community gatherings, and which has compelled us as MenEngage Africa to take a deliberate action to conduct a 5-day gender transformative workshop to make sure that we increase or we enlarge the pool of trainers or the pool of facilitators in country, because there's been a huge demand for this facilitation across the country. So for us, that seems to be what is to be a huge gain for the various interactions that we've made as a country. I think maybe with the time remaining, we've got about exactly 11 minutes remaining. I'd love to invite my fellow panelists that we respond to questions. I've tried to go through the chat box, and I found 3 questions. The first one, which I'd love to give to Clivette, because it's a reaction from the presentation that says, the question says, are you saying when women are more educated or earning more money in relationships, that is a motive for the IPV? Can you clarify around in terms the relation between the empowerment of women, if ever women are a partner is highly empowered in terms of financially, how does that then promote intimate partner violence? How is it related to intimate partner violence? Can I give you a minute, Clivette, just to respond to that question, please?
Yes, Bongi, thank you very much. I saw the question, and I almost answered it in my previous talk now, but then I thought maybe let me allow you to finish first. And again, I'm not saying this doesn't say that women, when they are empowered with knowledge and financial capacity, it's motivating them to, or it makes them to become, or motivates IPV. But again, I'm going to go back to the issue of safe spaces, and obviously it's a fact already. When it comes to a male being financially capacitated and with more knowledge, men have been perpetrators of gender-based violence, and women have always been victim. But we have seen a paradigm shift when it comes to intimate partner violence, and specifically looking at intimate partner violence, where we have seen that a lot of men, male partners, have become victims, silent victims, because the safe spaces for them to report such violence towards them is not available. And I don't want to I also I want to go back to what I've mentioned earlier when I was talking about what violence is. And I just want to remind the colleague, thank you very much, who asked the question, that violence or intimate violence is violation of human rights. It denies the human dignity of the individual and hurts human development. So we have seen cases whereby in a relationship, the woman is more educated, holds a higher position, and earns a bigger salary. And we have seen cases where the man is being emotionally, economically, and psychologically being abused. And these cases are not reported until the male partner then retaliates or reacts violently towards the female partner, and because obviously of patriarchy and the men being more strong, he reacts violently, and then the case is only coming out, or the issue is only coming out when the woman is being physically abused. But you will find that in many cases, this man is telling you that, look, I have been oppressed for the last 10 years, where my woman is addressing me as I'm not a contribution enough to the family. I am not adding enough to the family, and also I'm not in control of who she becomes friends with, and she's sleeping with other men because I cannot bring enough. Where we literally seen kids growing up at home not respecting the father and not having respect for the father because of how he's treated by the mother. And that is what we say, sometimes with the increase in knowledge and economic empowerment. And I was literally basing this notion on child being left out, and us empowering the girl child. It's gonna force us to go back and empower the boy child. So that was my whole idea of saying that increasing knowledge and financial capacity could motivate intimate partner violence among partners. Thank you both.
Thank you, Clive, for that response. I think maybe my contribution will be that in the context of socialization, resources and all the financial power and any form of influence is reserved for males. So now, whenever the partner is motivated, is highly empowered in terms of financially and educated, when the wife, in most cases, and with that socialization, the first result for men, what men normally use, is they use violence to control, to reclaim the power, because actually, in most cases, it's not necessarily mean that the woman needs to even say to break about being financially empowered or highly educated, but it's just the fear that is embedded through our socialization. So there is an important need to continuously deconstruct those harmful socialization to make sure that will make men understand that women being empowered does not mean that you are no longer the husband. But based on the fact that our socialization says all the resources need to be with men, it then perpetuates violence whenever men then tend to decide or resort to use violence in terms of trying to control their partner who's educationally or financially empowered. So those are some of the things that we've seen around that tends to then drive the issues of intimate partner violence amongst partners. Maybe let's also move to the other question. There is this question that touches on issues of mental health, that says the issue of mental health seems to be the gap in addressing intimate partner violence or GBV before it happens. The question is, what interventions or what support systems that are there in our respective countries, or it's maybe in Eswatini or in Namibia, that help deal with mental health issues at community level? What interventions do we have? Maybe I can request Alice Are there any systems that are there in community level in the context of Namibia that helps in addressing issues of intimate partner, that helps in preventing GPV or IPV from occurring?
Yeah, Bongi, like I've mentioned previously, we do have community intervention programs at community level in different regions of Namibia, different organizations that that engages with communities on the topics of IPV, GBV, violence as a whole. Secondly, on the issue of mental health, and the question is, I'm wondering what is happening at community level for intervention and supporting mental health issues. Lifeline Childline is an NGO, the only NGO in Namibia who has toll-free helplines that is accessible to communities from all over the country. Now, on the toll-free helplines, we have the Child Helpline 116 and the GBV Helpline 106. That is where communities can call in and they will be assisted by a team of qualified counselors and social workers. But also with our community interventions, we have community-based counselors that can provide on-site counseling to community members if and when needed. Other organizations, because of the advantage that Lifeline has with the helplines, they constantly, when they engage in communities, they also promote the helplines, because for communities, some would find it easier and more effective to just call a toll-free helpline instead of taking a taxi and go to the center for face-to-face counseling. So in Namibia, yeah, I'm proud to say that we are making great efforts in addressing those needs at community level.
Thank you, Alice. Colleagues, in the interest of time, I'll just respond to the question on how the selection in terms of the community leadership, those who have been implicated to be violating their partners, how is the selection criteria in terms of ensuring that they don't participate in the leadership position? Well, this is not referring to those who've been formally charged before the court of law, but then in most cases in the context of Eswatini, in these cases they are presided over at the traditional structures from the customary side of things. So whereby you find that the processes are very quick to determine if ever that particular individual has abused or perpetrated that form of violence. So they don't need that case to go through the court, the formal court set up for them to determine if ever that particular individual is guilty. And also, one other thing, they do not only, what their commitment is to say, anything that has to form in the leadership of this particular community. If ever you've been implicated to be abusing your partner, or it has been brought into the attention of the community leaders, you are not expected to participate in any leadership position. And also, yes, we are still moving towards a direction whereby they will not only deal with, they will only not stop you from being in a leadership position, but we want to reach a point whereby even the community leaders will take serious steps in terms of punishing those who are perpetrators of intimate partner violence. But then with our continuous engagement, we believe that we will reach a point that these perpetrators, community leaders, take serious steps, and also in terms of reprimanding those perpetrators of violence. And also, in our context in the Kingdom of Eswatini, those community positions, they are highly regarded because they are very influential. As Moyo has alluded earlier, that the customary law structure, the dual legal system, the customary structure is very influential as compared to the common Dutch law, because the Chief Justice, that side is His Majesty, whereas this side, the Chief Justice reports to His Majesty, the King as well. So that's how the structures in the country are being, that's how they are set, and also how they want to influence and influence the leadership in the country. So now I'd love to invite Clive to sum up our conversation, because I don't see any other question that I've left out, or maybe he can also touch on another question that has been left out. Thank you, colleagues.
Thank you very much, Bongi. I think, for interest of time, I believe what has been said so far, as we have done justice to it. I'll probably maybe look at my co-chair from my country, Miss Alice, if she has something to add. I think, in regards to what the discussion was, it was very meaningful, and we appreciate the interaction from the colleagues. I could be losing network. That's why I don't want to be talking too much now, because I might be losing network in the few seconds. And I would like to hand over to my colleague, Alice.
Thank you, Clifford. Yeah, colleagues, thank you for joining us, and I hope that you can take something away from this session. I would further like to encourage all of us, especially the MenEngage network members, let us continue to carry the message of IPV. My personal opinion is, in the bigger picture of violence against women and children, IPV has been left behind. And let us take the challenge to speak out more and to direct our activities and our commitments more to IPV as a whole. Thank you, colleagues. Thank you.
Thank you, colleagues. I'd love to take this time to appreciate everyone who's joined this call, and to say let's continue with the conversation. We will share our emails on the chat box, so that we continue the conversation even beyond, and so that we would love to also consult with you, colleagues, on other things. And also, we, as MenEngage Africa, we promise that as soon as our study report is finalized in terms of the graphic designing, and then we'll then share with everyone, we'll share the link, and we, as Sithandegile has requested, that we share our email addresses on the chat box. We want to, as soon as the report is ready, we will share with everyone. I'd love to appreciate everyone who's been here, and also request this time to take this time to request my fellow panelists to write their emails on the chat box, so that our colleagues can be able to get in touch with us. Can I request that my fellow panelists say their goodbyes?
Thank you so much, colleagues, and thank you, everyone. It was a good session, and we believe that this has opened avenues for collaboration, because we have realized that most of the challenges that we are facing are almost similar. So thank you so much to everybody, and we look forward to continue sharing and learning from each other in the region and the globe. Thank you.
Thank you again, colleagues. It was really a privilege to share this with you, and I'm looking forward to further engagement. From MenEngage Namibia, it's goodbye.
Clive.
Bongi, I think we lost him, so we can go ahead.
Okay, thank you, colleagues. I'd love to appreciate everyone who joined in this conversation, and also appreciate my fellow panelists. And we will continue with the conversation, colleagues. And also, I'd love to apologize on behalf of everyone who was part of the panel in terms of the issue of time. Apologies towards that. And for me, this tells me that it shows how this issue is deeply affecting us. And we also need to continue with the conversation across countries so that we are able to find what works from the other side and utilize it in our respective countries. And thank you, colleagues. We really love to appreciate your presence. And without you, this call wasn't going to be this success. Thank you.